We did, but it's okay. All right. Well, we will move on to the final presentation. That video was so quick that you couldn't even see it. You've heard about what we've been doing in the past. You've heard about all of the work that we're doing in clinical services, training, research, and community engagement. But what we need to know now is kind of where we're headed next. So with that, I will turn it over to Dr. Armstrong, and he'll say where we're going next.
Thank you, Jason. There we go. We're not clicking today. I wonder if we're losing our... Last PowerPoint. There we go. Okay. Well, I do want to say something. I'll fill that gap while we get the PowerPoint up. Over the years, we've had significant support from, of course, as you heard, the Mailman Foundation, the Joseph P. Kennedy Foundation, the Batchelor Foundation, and more than 1,700 individual donors who have supported the growth and the progress of the Mailman Center. And we like to talk sometimes about return on investment. I think what you've heard today when we talk with our donors, we have been able to show a return on investment, not in terms of dollars. We certainly have increased our dollars, but really in terms of the impact that we've been able to have. And so we could not do the things we're doing without the support and the generosity of so many people, many who are in the room today, and who have helped us with this. Okay, now we're getting. All right, let's see. Will it go? There we go. I won't spend a lot of time. We'll wait for this to get up in just a second. I will start off by talking a little bit about Eunice Kennedy Shriver. I started the conversation earlier today about the role that she played in helping to get the university-affiliated facilities started. But what I also wanted to talk about was a day in 2008. Dr. Howell mentioned this earlier in his talk. I got a call. I was invited to go to Bethesda for an event. And the event was in one of the theaters on the NIH campus. And it was attended by Dr. Zerhouni, who was at that point the director of the NIH. Orrin Hatch was there. Ted Kennedy was there. Even Arnold and Arnold Schwarzenegger was there, along with a group of about 300 or 400 people who were invited to attend. The reason for the event was to name the National Institute of Child Health and Human Development after Eunice Kennedy Shriver. The really exciting piece that came out of that was phenomenally beneficial and a great experience for me. But when I got back to Miami, Carmel met me as I came into the office and said, Mrs. Shriver's office called. She wants to come visit on Monday. And on Monday afternoon, we were blessed to have Mrs. Shriver and Sergeant Shriver come to join us for a really great afternoon. Mrs. Shriver was, I think, about 87 years old at that point. She had talked with me before about the early role that she had played and the Kennedy family had played in the founding of the Mailman Center. So I've kind of expected we get a chance to reminisce a bit. We're still not getting the screen up. We're working on it. Okay. So I'm going to keep going. But I thought we would reminisce for a few minutes and then we'd go. Now, I have to say, you know how sometimes you hear people talk about meeting celebrities and not wanting to wash their hands? I've not cleaned the seats of the chairs in my office because sitting in those two chairs was Mrs. Shriver, who had been the driving force behind the creation of the NICHD, the driving force behind the first 94 Public Law 94-142, the first special education law, public special education law. She'd been the person who had designed the university-affiliated facilities with Dr. Cook. Just the talking slides, so you have something. Okay, yeah, I've got that. And she had been also the creator of Special Olympics. That in itself is really impressive. But sitting next to her was her husband, Sergeant Shriver, who was Herbert Humphrey's vice presidential running mate in the 1968 presidential election, and, oh, by the way, the designer of the Peace Corps. If you ever had the opportunity to sit in the face of greatness, that was it. And so we were so fortunate to be able to, we got slides. Let's see if we work here. We were so fortunate to be able to talk with Mrs. Shriver. She talked for about 15 minutes, and then she leaned over, and you heard from her son earlier the question that she asked, what's next? Mrs. Shriver spent the next 3 hours with me talking about what's next. And let's hope we get this one up here in a minute, because I do have a video to show. But it's a beautiful picture. As we talked about what's next, that led us to a number of very exciting things that happened. One, I had a reporter from the Miami Herald who called me and said, can I swing by? You've been at this for about 40 years. I'd like to do a story in the Miami Herald. We got a color photo headline above the fold front page. Now, if you know anything about newspapers, which nobody has anymore because it's all on our iPads, but if you knew that was a pretty good deal to be able to get that level of courage. And the headline was changing the future. It's hanging in my office if you ever want to stop by and see that print. But that started us off on this process of what Mrs. Shriver had to say about what's next. As we moved through, Michelle Staudant had attended the leadership conference, and we were all talking about a strategic planning retreat. And so we put that together here at the over in the Life Sciences Park at the time, and we pulled together about 45, 50 people from all over the community, the medical school, other parts of the university, and we spent the next 3 days really going through a process of sorting through what do we want to look like, what were those priorities, did we need to do a redesign of how the world was working. And we were actually able to be very successful, and what came out of that was revolutionary. Now, I have to say that what came out of it was a little disturbing to some of us because it was a significant structural shift from operating as a center with a lot of disciplines to operating as a center with interprofessional collaboratives, where people came together regardless of their discipline, but aligned with their interest around promoting behavioral health, around community wellness, lifespan, neurodevelopmental intervention research, neurodevelopmental basic science research. And it created an entirely new model around these core functions that we've talked about today. It was a struggle. I have to say I sent our model to some colleagues at some of the other University Centers on Excellence in Developmental Disabilities around the country and the LEND programs. And one of my colleagues in Minnesota sent me a note back that, actually in Wisconsin, sent me a note back that he had shared the slides and what we had done out of our strategic planning process, and they had only had to call the ambulance 3 times for the heart attacks of their staff when they saw what we were doing. But out of that whole process came an incredible opportunity for us to think about a future that was really quite different. What we came up with was the vision statement that you've heard so many times today: improving lives through innovation, impact, and connection. And that, Jason talked earlier about that piece being something that was very important for us. It's still not moving. Okay. That was very important for us because we now use those terms to think about everything we do and making sure that when we invest in a project, we are doing something innovative, that we are doing something that's going to have impact, and we're doing it with someone else. As we've moved forward with this whole process, we created a model. This is the model that we had of these interprofessional collaboratives with a great deal of impact from our Mailman Advisory Council that really helps to guide us. And we built it on the infrastructure of our large programs that you've heard so much about today. As we've moved forward with that, the other piece was that we were no longer a Mailman Center in a building on this campus. And as we have moved forward, this cartoon shows something that is, I think, really extraordinary, that talks about the matrix nature of our center. All of those little bubbles are departments, colleges, schools, centers, and institutes across the University of Miami where we have a project, a member, a collaboration going on. It's a pretty nice piece. Some of the things that we've heard about today, our PATH clinic, a clinic for adults, older adolescents and adults with developmental disabilities, is a collaboration with the Department of Medicine. We are working on a full integration with the Department of Otolaryngology and the Children's Hearing Program and the program that Dr. Pfeiffer has developed so well over the years for an integrated hearing program. And we are just in the process of starting to work on a training program for all staff and faculty of the Bascom Palmer Eye Institute on how to work with individuals who need eye care who have autism or some kind of related disability. So we're going to be working on these kinds of big things. Of course, we work with CART, with Sylvester, and other programs all across the institution. It really made a difference in terms of our outreach. You've heard partners. That's part of the list. I stopped putting all the names of all the partners, affiliates, and things that we've been doing. Of course, our close relationships over the last several years with Overtown Children and Youth Coalition, with Connect Familias, with St. La, a long history with United Way, of course, the major work with the Children's Trust, Miami-Dade County Public Schools, Miami-Dade Fire Rescue, and the list just goes on and on and on, because that's where we connect. One of our most significant components of the last year or two has been the negotiation and then an 8-figure gift to the Miller School of Medicine, Mailman Center, Department of Orthopedics, Department of Physical Medicine and Rehabilitation, and the Holtz Children's Hospital to affiliate with the Shriners Children's Hospital to create 2 endowed chairs, a new clinic for pediatric orthopedics with rehabilitation and support for our AT program to really be able to address the needs of children with physical health needs and mobility needs. Those have been really significant kinds of impact. What we've done, Mr. O, you'll be really happy to see this. In today's dollars, the amount of money that the Mailman Center had when it began in 1971 was about $21 million, about $10 million. Today, we just reported to the federal government $42 million in leveraged funding for the center for this year. I think we can keep the doors open. I think we can keep the doors open. One of the things that's important as we look to what's next is how we think about change. There's a 2-loop theory of change that I've heard. It basically talks about established systems that really go up and hit a peak, and then they start to fade out, and then something comes in behind them with experimentation. Disruption is the key, and then ultimately that new emerging system replaces the old one. We have a different idea, and that is, why wait for something to be disruptive and damaging? If we can go to the next slide. Why don't we go to, there we go. Why don't we go to a plan that is expanded? And think about if that two-loop system of change means that one has to die out, then why wait until it dies out? We're at the top of our game, and we are right now starting to think about, let's create a new emerging system that builds on the strength of what we have without being disruptive and takes us to an entirely new level. And then in that area where we've typically had the drop-off, let's share what we've done broadly with our community, with folks all over the country, so that they can benefit from what we've done while we spend our time developing what's next. That's what we're really all about at the Mailman Center. So we were going through a strategic planning too that we had this spring, and we've developed three primary priorities, and these are rough because we're still panning them out, but we want to develop and implement training in health equity, disability, and evaluate those outcomes. Health equity and social justice are crucial to where we are as a world for people with disabilities, and the intersection of people with disabilities with other kinds of factors. And so being able to make that a priority in what we do is crucial. We need to really make that next step to where we are doing community-based participatory work in all areas, not just our research, but our training, our service, and across the board. And we want to innovate and evaluate the use of technology to increase access to effective services. We talked at the beginning that there were complaints about the fact that we had 2,000 people taken care of here at the Mailman Center. It wasn't enough. I said earlier 15,000 is not enough. We can't train enough people to meet the need. I had the chance in 1999 to work with Dr. David Satcher as the Surgeon General of the U.S. on the Surgeon General's report on child mental health. The ratio of children who met diagnostic criteria for a mental health disorder to the number of providers in any discipline, the ratio was 900 to 1. Out of COVID, we think that's more like 1,750 to 1. We don't have enough providers. We can't produce them fast enough. So our job is going to be able to figure out how can we provide access using new technology, using new approaches that help us to impact this on a large population level. I'm not going to go into these things. These are just some examples of some of the things that we're doing in each of these areas. But I do want to go to the last one on the technology, or actually on the equity and participation. And that is in our USAID grant last a year and a half ago, we put in a little idea that we wanted to develop a training program for people with disabilities and for investigators so that folks with lived experience and disability can be part of all aspects of a research team. Well, that has taken off, and we're going to be doing some of our little project here, but that was just approved a month and a half ago by the National Steering Committee from NCATS and the Clinical and Translational Science Awards program in a collaboration with the AUCD network, all of the LENS and USEDS and intellectual and developmental disabilities research centers of the country. And we are now doing a national project to develop that kind of toolkit for training researchers on how to include people with disabilities in all aspects of their work, and to train people with disabilities how to be full participants in that process. So this is really another very quick national uptick in where we are. We've also working on this issue of technology. You saw Jason with the cool VR glasses up here, but imagine for just a minute that we can take advantage, and we've already done some work in this area, but the future, we've talked to folks from Microsoft, and we will be talking with folks from gaming companies and with our computer science group and our biomedical engineering group, because the opportunity to think about AI, which scares us to death, the artificial intelligence, but to think about being able to apply artificial intelligence in such a way that an individual with a severe developmental disability who has to use a typing pad to generate very slowly language, So when you're sitting in the room and you ask them a question, there's a 2 or 3 or 4 or 5 minute while they type, and then there is a very monotone computer-generated response. Imagine being able to use artificial intelligence so that that individual can develop their own voice, their own inflection, their own emotion, and can fully participate in real time using that type of technology. We're looking at those kinds of amazing opportunities, and we want to be part of that kind of vision going into the future, because that's where we will make a difference. I've got some other strategies up here, personalized approaches to developmental disabilities. We'll be working closely, I know here, with our rare disease group. Mustafa Tikan is here, who runs the rare disease registry. Our new director of neonatology is going to be looking at targeted sequencing to identify children in the newborn area and the NICU who have rare diseases, where we can begin to understand the natural history, intervene early, and develop personalized approaches to altering those kinds of trajectories. There is so much excitement for us as we go into the future that it is almost unbelievable. Now, I'd like to, if we can go back and let me play the first video, the one with Xavier Cortada, and then I'd like to finish up with just a couple of slides and some comments from our Dean and President.
I think the real disability is an inability to love one another. I think that's a real disability. And if we can begin to empathize and care and love one another more, I think that we're going to be in a better place. And through the art, I think we unlocked that ability to communicate those ideas. And here, across all the hallways of this center, those words and ideas resonate in full color.
I just wanted to have a chance for you to tell a little bit about the work you've done and the impact it's had in disabilities. Also to give you some credit for having started what is now one of our major annual programs, the Art Abilities program.
First of all, thank you. And thank you for your leadership. Thank you for growing and building this incredible gem of an institution that just transforms our university and our community, but literally, our society, the way we think, feel, and especially love one another. I know that because it transformed me when I was creating these pieces. And I think in many ways it helped propel me in my work to engage communities in problem solving. And I think the reason art was the vehicle that I chose is that art is disarming. Art is this universal language. It brings everyone to the table. And I remember all the faculty and the advocates and the clients, the patients, the community that we worked with. They're really the ones who started Art Abilities. It's this really beautiful collaborative process that we all came together. As you walk down the halls, you see their expression. And each of those little drawings that are created is another moment in our 50-year history that says that during that time, this one person loved, served, cared enough to be a part of the Mailman Center. And if we can inspire the rest of our community to understand that each of us have a little stroke to add with our paintbrush. We had a PhD MD faculty member, a dear friend by the name of Jeff Brosco, who's really the inspiration behind this piece. He's a historian. He came up with the idea, let's do a mural about the history of disabilities. And the wonderful thing is that he taught me, about the history of disabilities and this path of growth with the building blocks of different legal cases, legislation, institutions, individuals who through time helped transform this. And I know that in many ways what the history of disabilities is a history of individuals who had enough self-love and dignity to change, literally to change the society to be accepted and understood. And they did that. They transformed that. It's actually the most inspiring of stories if you think about it. And that's what this mural depicts. It depicts this transformational change, from some very dark times for most of human history to what just happened in the last century. And what I have seen as I look at this mural, even when this mural was created, it was part of an exhibition that we created. And if I look back, this was back 2 decades ago, how much change and how much transformation has happened in our society since. How much better it's getting, thanks to the work you do and the work of this Mailman Center. How beautiful this incline is going up. Understanding there's so much more that still needs to be done.
It's the hope, and I do kind of think we talk about it as a history of disability, but it's an inspiration for the future. One of the others that is very important for us is the inclusion one.
So the exhibit and art project we created with Debbie's school, it's talking about the importance of having inclusive nature. It really shows her the voices. This was done with little children. There's a lot of handprints and notes and messages about the services provided and the need for more. I think that we as a society understand the value about having a diverse world, a more textured, rich tapestry of human experiences. And all of these projects were also in part sponsored by the Cultural Affairs Council through their community grants. It's always been interdisciplinary, and it's always been about leveraging and working across communities. By demonstrating the good we did here, we were transforming the governmental institutions so that they would create entire programs to have other institutions across Miami-Dade County. And that's the beautiful ripple effect of the knowledge you develop here and the work you do here, that it transforms the society. And I think that's the gift of these 50 years, right, at the Mailman Center.
The other thing that's what's next, the people on this slide. You've seen them today present the work that they're doing. Our next big step is to develop and support and mentor the future leaders of the Mailman Center. You heard Mr. Ronarati has been here. He was the first 25 years of this. Dr. Howell knew Joe Mailman. I've been around a long time. We won't be here forever. And for us to be able to move forward with a model of leadership, and it's not one leader, it's a team of leaders who have shared leadership who helped us make forward. And I shot this screen yesterday as we were talking about today and getting ready, and it doesn't capture all of our leaders. But a number of years ago, I had a very serious condition. I was lying in the hospital bed getting ready to go into surgery. Of course, I thought about my family. Then I thought about the Mailman Center, and I thought, I don't have to worry. If something happens to me, we're okay. And we're going to be better and better as we go along. So investing in the leaders of the future is going to be an essential component. If we can go to the next slide, please. I do want to point out some really important parts. This is what we're all about. And that's the people that we develop over the lifespan. Now, we've talked a lot about children, but I want to talk about two people who were our first quote-unquote patients here at the Mailman Center. Kent, who is going nuts up here holding up the U. And Michael. And where did Michael go?
I don't know. He was here with Walker.
He was there just a minute ago. Oh, can we bring him back in, please? I do want to point out to these two people. Kent is a member of our Mailman Advisory Council. He has been that for as long as I can remember. He's part of the CARD program at the University of Miami down at the Coral Gables campus. Yes, you did, Kent. And so Kent is one of those people who's gone from... Yes.
What's his name? Forget the other sergeant's name.
Well, they appreciate you so much, Kent, and we do too. This is what our children grow up to do. And Michael, who will be around in just a minute, Michael, everyone who was here for a long time, Michael started off as one of the children and retired when he was 65 years old. And and everybody who knows Michael has gotten an envelope that is as recognizable as anything you'll have. Dr. Howell and I were talking about it the other day, because that envelope has Michael's handwriting and a lot of stuff all around it saying, and he is best, we got to hire him for our advancement group. He is the most persistent person to come after you to give a check to the March of Dimes as there ever existed.
Oh, yeah, I remember that.
He's also one of the most successful fundraisers in the history of Special Olympics. So we really are very excited about Michael, and he was going to make a statement here, and his mom was going to as well.
I gotta tell you, there's a picture of me back on the computer in Dr. Scott's library.
Yes, that's right, Kent. There
And
is.
there's me standing next to Dr. Scott while he was getting an award at the Card Awards thing.
Kent has been in many, many pictures as we go through. Let's go to the dean's comments, and perhaps Melanie and Michael will be back in just a minute.
Let me apologize for the fact that I cannot join you in person to celebrate the 50th anniversary of the Mailman Center. I had really wanted to be part of it, but unfortunately, due to some conflicts, we could not make it work. But nevertheless, I'm with you in spirit today. When I first came to the University of Miami as Dean of the Miller School of Medicine, I heard from Dr. Rodney Howell, former chairman of the Department of Pediatrics, that the Mailman Center for Child Development was one of the jewels of the School of Medicine, as well as of the university. But boy, how right he was. As we have heard today, the Mailman Center has been steeped in the rich tradition of national policy since the 1960s, starting as a concept designed to produce a workforce to help individuals with developmental disabilities move from institutions to community-based care, and evolving into an institutional, community, state, national, and in some cases, global force. The vision statement of the Mailman Center, as we have heard today multiple times, is to improve lives through innovation, impact, and connection. The visionary support of Abraham and Joseph Mailman and their families, the Joseph P. Kennedy Foundation, and many other donors, including local, state, and federal government, as well as foundation grants, have helped make the Mailman Center one of the premier centers in the United States. The trajectory of growth of the Mailman Center over the past 50 years has been truly remarkable. Starting as a program with less than $5 million of resources to carry out the mission associated with this distinctive building, the Mailman Center today leverages over $45 million annually to support the wide reach of its programs. This includes the training of approximately 100 graduate and postgraduate students in neurodevelopmental disabilities, with almost 60% being minority students underrepresented in medicine. It is notable that the Mailman Center trains nearly 25% of all Hispanic trainees in federally supported leadership education in neurodevelopmental disabilities programs for the entire United States. When the Mailman Center first opened, it was publicly criticized in the media for not providing services to enough children. But today, the Mailman Center provides services to approximately 15,000 children annually through its many contracts. But more importantly, it partners with agencies in our community to provide training and support to enable those agencies to provide needed care. The work of the Mailman Center faculty to expand access to evidence-based services and to use technology to expand access despite transportation challenges are examples of the innovations that have driven the success of the Mailman Center. The impact of the work of the Mailman Center has been far-reaching. In fact, The Dr. John T. McDonald Department of Medical Genetics at the Miller School of Medicine studied as a division of the Mailman Center. It is now ranked number 2 in the country among all genetics departments according to the NIH Blue Ridge rankings. That's remarkable. This past year, the Mailman Center's interprofessional perspective and commitment to addressing the needs of children with disabilities led to a partnership with the Shriners Children's Hospitals that will significantly expand pediatric orthopedic and rehabilitation care, as well as research at UHealth and the Jackson Health System. The work of the faculty of the Mailman Center supported the growth of language development in children with hearing loss and led to expansion of our cochlear implant program in collaboration with the Debbie School and our Children's Hearing Institute. The pioneering work of Dr. Tiffany Field related to touch revolutionized care of premature infants, and the seminal work of the Infant Health and Developmental Study and the Legacy for Children study had a huge impact on our understanding of early development of infants considered at high risk. The Mailman Center has adapted to emerging trends. Its faculty have been national leaders in long-term developmental effects of children treated for cancer, sickle cell anemia, HIV/AIDS, diabetes, cystic fibrosis, exposure to illegal substances, toxic treatments, repeated general anesthesia, and emotional and psychological trauma, just to name a few. Programs that evolved from the research led by the Mailman Center faculty have been replicated all over the world. Over this past 50 years, faculty from the Mailman Center have served on and have been leaders of federal committees related to policy, NIH multi-center studies, state agencies and councils, as well as local agencies and task forces focused on children with disabilities. They have been consultants to the Executive Office of the President, the National Academy of Medicine, as well as ministers of health and education of other countries. The impact of the Mailman Center has been wide and deep. Dr. Howell was correct. The Mailman Center for Child Development remains one of the jewels of the Miller School of Medicine, and its rich tradition of looking beyond its walls and current programs to see what can be done better continues today and is the cornerstone of its raison d'etre. I am grateful for the donors, faculty, staff, trainees, as well as community partners who have made the vision of improving lives through innovation, impact, and connection a living, breathing reality through the Mailman Center. Thank you for your attention.
So I'd like to introduce Melanie Jacobson and Michael Coleman for some comments.
Thank you, Dr. Armstrong. Michael was actually the Mailman's first student. It was never anticipated that anybody older than about 5 would be attending the Mailman Center programs. But as you may have heard earlier, my mother was involved in helping the opening celebration for Mailman Center, and she had an opportunity to speak with the various people that were in administration at that time. And Dr. Joseph Grassi was very important in a prototype of computer that helped with basic skills. Michael had actually come home from a very lovely private school in New York and dedicated to children with developmental disabilities. But now he was 18 and what to do. And Dr. Grassi thought that Michael could benefit from the machines that he was working on. And so Michael, mother, my father, our father, and me worked with Michael one day each week. And after a relatively short time, Michael was given a white coat and a stethoscope and his own office with a telephone, and he went on to become a 42-year employee for the University of Miami at the Mailman Center. He adored being here, and unfortunately, a series of injuries left him with me, so that he needed to come up to Palm Beach County so that he and I could look after one another. So he's enjoying his time now. He's a client of the ARC of Palm Beach County, and he's involved in their programs. One of his favorite is art, and he lives in a home, an apartment with, at this point, just one other person. It's on the grounds of where there is a group home. But he lives independently, as he has done for most of his adult life. And he's on a wheelchair. I mean, he's with a walker today because 2 months ago he fell. And mercifully, they were non-displaced fractures. And he went through rehabilitation like a champion. And here he is today. This is his first outing. Michael? Would you like to say something? Do you want that microphone, or would you like to talk into this? Say something, sweetheart.
I've been here for 42 years. I started in 1974 as a clerk, and I left in January 2016 to go to Boca and Palm Beach. And now I'm here today to give Danny a check for the Mailman Center.
So from Michael's personal account, he's giving Dr. Armstrong a check for the Mailman Center.
Michael, thank you so much. Now, you've come to me for checks for many, many years, and I really appreciate the return to the center. This place, you're part of the fabric here. And we just treasure all that you've been able to do for us. Thank you so much.
Thank you.
And thank you for coming down today.
Come, Michael.
All right, well, step now
Over 50 years.
to a message from President Frank.
Over 50 years ago, a novel idea took hold. The federal government would begin funding programs to help individuals with developmental disabilities move from institutions into home and community settings. The Mailman Center for Child Development at the University of Miami was one of the first 11 university-affiliated programs to bring that idea to life. Since it opened in 1971, the Mailman Center has grown from a training program that served about 2,000 children a year to one of the largest such centers in the nation. Today, it trains nearly 100 postgraduate students each year from more than 12 disciplines in developmental disabilities research, service, and leadership. More than 15,000 children receive services from Mailman Center programs, and many more benefit from the center's support and engagement with community partners. Investigators at the Mailman Center have impacted the way care is provided to premature infants, children with autism, cancer, sickle cell disease, HIV, and diabetes, and some of the programs developed here have been adopted by other countries. Before the terms inclusion and equity were common, the Mailman Center was leading efforts at the Debbie School for Young Children with Disabilities and serving adults with disabilities who were self-advocates. During the pandemic, the center intensified its work in supporting the rights of individuals with disabilities to have access to high-quality acute health care. The training models it developed for healthcare providers are proving useful even after the COVID emergency. Central to its mission and success, the Mailman Center has partnered with local community groups to address not only the needs of individual children and adults with disabilities, but also to impact entire communities at a population level. Over its 50 years as a unit of the University of Miami, the Mailman Center has exemplified the value of an academic program, improving lives outside the university by generating, evaluating, translating, and sharing knowledge. I am sorry I was not able to be with you in person to celebrate this milestone, but I am delighted that you have taken the time to hear a compelling story of how the University of Miami contributes to the well-being of our community. Congratulations to the Mailman Center on 50 years of exceptional impact. I can't wait to see what the next 50 will hold.
You've heard today the story about a center that has discovered chromosomes related to Fragile X, that has done community involvement, that has impacted other countries, has focused on saving the lives of black babies so they see their first birthday. It's a big issue. We always ask, what does the Mailman Center do? We've kind of seen a little bit of it today, but we all do it because of those three key terms that we have. One, innovation, doing things differently, leading rather than responding to market and policy change, having an impact, making a difference not only at a child or family level, but at a community and a population level, and connections, doing things together with both historic partners and collaborators that we've not previously even considered. So as we think about the next step as we move forward, one final thought is that what we do at the Mailman Center is really quite simple. We embrace innovation, we strive for impact, and we achieve success through those connections. Thank you so much for joining us today and embracing the Mailman Center, its vision, and the thoughtfulness, commitment, and passion that we bring to the table. With that, we'll wrap up with one final slide, and when that's finished, we'll convene down in the lobby for a reception. We hope you all join us. Thank you all for joining us.